Hi, my name is Dan Plashik. I'm an RN case manager. I currently work at a local behavioral health hospital here in the Milwaukee area. I've been working at this behavioral health hospital for about 10 years now. First as a floor nurse for about 7 years, and then as a case manager the last 3 years. Now I can't directly say that I've experienced workplace bullying and harassment in the healthcare field personally. However, I can tell you that I have experienced it in previous jobs. Nursing is a second career that I started when I was 40. Now, previously I worked in um, factories and restaurants, and I experienced workplace bullying quite a bit. I can tell you that it was very demoralizing, causing a lot of anxiety, stress, and depression. We decided that my partner and I, Sarah Peterson, who's a nurse in the Green Bay area, decided to do this presentation on workplace violence and harassment because it's very important. It not only affects the individual, it affects the organization, and it affects the people around you as well. So I hope that you enjoy the second part of this presentation, and I hope you learned something from it. Thank you. As we continue on with part two of the presentation, workplace bullying and harassment, we want to cover a few more objectives that were not covered in the first part of the presentation. In this section, we're going to cover what is the significance or impact that bullying and harassment have on nurses and the nursing staff. What is the significance of bullying and harassment on patient care and safety? And of course, we're going to look at what is the economic impact that bullying and harassment have on the organization as a whole. And then we're going to look at what are some of the things that are in place to protect you from bullying and harassment in the workplace, such as federal laws, state mandates, organizational policies and procedures. And lastly, we're going to look at the implications to nursing management that bullying and harassment have. What are some of the things that we can do to help prevent these things from continuing? Before I talk about the objectives I just mentioned, I'd like to take a moment and talk about the three individuals that I interviewed for this presentation. The first person I interviewed was Catherine Satterfield. She is the nursing supervisor on the Adult Services Unit. Then I interviewed Cynthia Seeger, who is the Adult Services Manager. And lastly, I interviewed Jamie Lewiston, who is the Vice President and Chief Nursing Officer for our facility. Now, I interviewed these three individuals for a reason. All three have different levels of management. Catherine deals with the staff on a more personal level. Cynthia sees the staff and talks to the staff on a more managerial level, as a group, as a whole. And Jamie sees the staff and deals with the staff on an organizational level. All three see the impact that bullying and harassment have on an organization and individuals in different ways. Catherine has been the nursing supervisor for a little bit over 2 years, and unfortunately, over those 2 years, she's had to deal with a few incidences of bullying and harassment. According to Catherine, an employee that is experiencing something like this tend to have a behavioral change. They tend to call in more often, they tend to isolate, and they tend to make more mistakes. All of these can result in issues not only to staff morale due to the shortages that are caused by absenteeism, but also patient care and safety. She is the go-to person or the first line of defense for somebody that may be having an issue with bullying or harassment in the workplace. Catherine takes this topic very seriously and has an open door policy for everyone that she comes in contact with, whether it be nurses, behavioral health techs, or health unit coordinators. Even if she is not directly contacted by somebody who is dealing with bullying and harassment, she may hear it third hand or even a rumor of it. In those cases, she immediately investigates the situation. She will talk to the staff members that are involved and see if there can be a resolution or if it needs to be taken to the next step, which would be the Adult Services Manager, Cindy Seeger. Cindy Seeger has been the manager on the Adult Services Unit for 15 years. And over those 15 years, she's seen her fair share of incidences of workplace bullying and harassment. Of course, also dealing with being a manager, she's also had to deal with the ramifications that come with these situations, such as loss of staff. Loss of staff is significant to Cindy because she has a hard time finding staff. Recruiting people and new staff members and new nurses, or even old nurses for that matter, into the behavioral health sector is very difficult. And with the lapse of time between trying to find somebody, hiring somebody, training somebody, it causes a lot more stress on the existing staff to cover the staff that was lost. This can result in low morale on the unit as far as both the milieu and nursing or the department in general. It could also cause patient safety issues and low patient care issues. Now, Cindy is the second line of defense when things are beyond what Catherine can handle. However, she is the first line of defense when it comes to anything that involves an MD situation, as those require the immediate attention of the Human Resource Department. Just like with Catherine, Cindy would try to resolve the issue as soon as possible. And in order to help guide her in the direction that she needs to go, the organization has a tool in place called the Fair and Just Principles algorithm. It's a flow sheet that Cindy can follow to help guide her in the direction that she needs to go. Whether it needs to, correction action needs to be taken, a disciplinary action needs to be taken, or the whole situation needs to be taken to the next level of the Human Resource Department. Unfortunately, despite numerous attempts to reach out to our Human Resource Department for an interview on their exact role in these situations, I never received a response. However, there are policies and procedures in place from the organization that guide us and Cindy to help in these situations. The third person I interviewed was the Vice President and Chief Nursing Officer, Jamie Lewiston. This is a relatively new title for Jamie within the past 3 years, but she's been working in the mental health field and at my hospital for the past 20 years in other various management roles. Jamie sees the impact of bullying and harassment in the workplace on an organizational level. She sees the hospital budget being impacted by reduced employee engagement and satisfaction, increased costs of hiring and training, along with reduced patient satisfaction causing reduced revenue for patients that do not want to return for further treatment if needed. According to Jamie, to help reduce the overall organizational and hospital impact that bullying and harassment have on the organization, it has instituted a Workplace Violence Prevention Steering Committee to help combat this issue. They also created a workplace violence site-based team for each site within the organization to help reduce these incidences. The overall goal for Jamie, Cynthia, and Katie is to increase workplace safety and comfortability along with increased patient safety and care, and to reduce the overall impact that bullying and harassment have on the staff and the individuals. The first objective I'd like to talk about is the significance that bullying, harassment, and violence for that matter has on nurses, as it can cause both physical and psychological issues in the short term as well as the long term. In a study done by Brewer, Mihal, Casanta, and Zhao in 2019, staff members that have been exposed or going through bullying, harassment, or violence tend to burn out at a quicker rate. These individuals have a higher absenteeism, show poor engagement, have a lower job satisfaction, have increased errors, and have a higher turnover rate. In another study done by Sawyer McCoy, 2016, these individuals that are also burned out and have been experiencing bullying and harassment also have a tendency to have a lower overall general health. These individuals can have musculoskeletal disorders, sleep disturbances, headaches, hypertension, and GI upset. And that's not even including the psychological distress that they could be going through, such as increased anxiety, increased stress levels, isolation, increased depression, and in severe cases, post-traumatic stress disorder. Another significant finding by the Sawyer-McCoy report is that nurses who witnessed bullying were also more likely to be bullied themselves. So it's not just the victims that are affected. People that observe bullying and harassment can also be affected later on. It's unfortunate because, as Sawyer and McCoy show in their report, that when it comes to situations of bullying, violence, and harassment, nurses want to tend to leave the employer altogether instead of changing units. This can result in increased distress in the existing staff, causing reduced patient care and patient safety. The next objective I'd like to discuss is the significance that bullying, harassment, and even violence has on patient care and safety. As I discussed in previous slides, the impact that this issue has on the organizational level and the individual level is significant. However, it is even more significant on the patient level. In an 11-study integrative review consisting of 7 studies from the United States, 2 studies from Australia, 1 study from Canada, and 1 study from the UK, it was shown that there's a solid connection between bullying and an increase in adverse event and a decrease in patient safety and care. Now, I want to discuss or define what an adverse event is. The Department of Health and Human Services defines an adverse event as an incident that causes harm to the patient in any way, such as a medication error, a patient fall, or even a delay in treatment. Now, according to the study, the data shown that of the 11 studies, there was an increase in medication errors, which were significant, an increase in patient falls, and even an increase in patient mortality rate. In one of the studies conducted in the U.S. in 2012, 18% of the respondents directly observed disruptive behavior, such as bullying, that led to an adverse event, and 12.3% of the respondents directly linked disruptive behavior to a patient mortality event. And in a study conducted in Canada in 2014, it was found all sources of bullying significant for nurse-assessed adverse events. So as you can see, this is not just a United States issue. This is an international issue, such as bullying, workplace violence, and harassment. And it causes a great impact on not only the organization as a whole, or the individual as a whole, but also on a patient level. The next objective I'd like to talk about is the economic impact on workplace bullying and harassment on organizational's bottom line. I'll talk a little bit about revenue, organization-wide and worldwide. According to OSHA, it is estimated that the cost of replacing a nurse for an organization can cost anywhere from $27,000 to $103,000 per nurse. This cost includes recruiting, hiring, orientation, training, and in some cases accounts for the loss of productivity while the replacement is being hired and trained. Now, on a more global scale, according to Brewer, Miho, Casantas, and Zhao in their 2019 study, the estimated total yearly organizational cost worldwide for new hires, medical care, loss of productivity, and other organizational outcomes due to workplace bullying and harassment is estimated to be about $23 billion. And according to Sawyer and McCoy in 2016, this cost of organizational cost doesn't even include the physiological and psychological cost and impact that it has, that bullying and harassment have on individuals, along with the cost of poor patient outcomes. And these numbers are why it's so prevalent of workplace bullying and harassment initiatives in the workplace. Prevention, promotion, trying to prevent these issues, trying to decrease these costs. The next objective I want to discuss is about what is in place to help staff from workplace bullying and harassment on a federal and state levels. On the federal level, according to the U.S. Equal Opportunity Employment Commission, harassment is a form of employment discrimination that violates the Title VII of the Civil Rights Act of 1964, the Age Discrimination in Employment Act of 1967, and the American with Disabilities Act of 1990. There is also the Occupational Health Care Act of 1970 from the Occupational Health Care Association. This act is to assure safe and healthful working conditions for working men and women by authorizing enforcement of the standards developed under the act, by assisting and encouraging the states in their efforts to assure safe and healthful work conditions, by providing for research, information, education, and training in the field of occupational safety and health, and for other purposes. And finally, on the state level, according to Wisconsin.gov, harassment in the workplace is covered under the Wisconsin State Statute, Chapter 111, Subchapter 2 of the Fair Employment Act. The next objective I want to discuss is what is in place within the healthcare field that helps with bullying and harassment in the workplace. On the occupational level, there's a Joint Commission report that was put out in 2008 called The Behaviors that Undermine a Culture of Safety that denounces bullying. The American Nurses Association also released a position statement in 2015 called The Instability, Bullying, and Workplace, also denouncing bullying. In conjunction with that, my organization has created policies and procedures to help eliminate this issue. These policies and procedures include harassment, violence, code of conduct, corrective action, conflict resolution, along with the algorithm I mentioned in a previous slide called the Fair and Just Principles, to help promote a safe work environment. To go a step further, there is also a new initiative in the works within the organization called the System Nursing 2020 Strategic Plan and Tactics. This strategic plan, along with the policies and procedures I just mentioned, are designed and in place to help increase work safety, job satisfaction, patient care, as well as reduce workplace bullying, harassment, and even violence. The last objective I'd like to discuss is what the implication of bullying and harassment can have on the organization and what it can do in its fight against it in the workplace besides just policies and procedures. The first thing that management could do, according to the Academy of Medical Surgical Nurses, is for management to examine their own behaviors. According to the Brewer, Miho, Casantas, and Zhao 2019 study, a lack of response or action when an incident is reported to management can be seen by the individual and staff as organizational betrayal. The data showed this could result in poor job satisfaction, poor engagement, poor patient care, and the eventual departure from the organization by the individual and other staff members. This resulting in an increase in spending and a decrease in revenue by the organization. According to the Academy of Medical Surgical Nurses, the role of leader-manager is crucial in developing a positive workplace culture that supports a high level of professionalism and culture of zero-tolerance bullying. They go on to say the organization should insist that leaders and managers lead by example, champion, respect, and set the tone and expectations for behaviors essential for fostering a harmonious and collaborative environment. To do this, they state that the organization should ensure that competency standards specifically include managing bullying and that these standards are maintained through an effective performance system. The organization should develop more open communication and increase access to senior nursing management, and ensure that nursing supervisors have adequate non-clinical training for their role. A couple of other things the organization can do to help nurses in the fight against bullying and harassment, according to the Academy of Medical Surgical Nurses, is for the organization to provide ongoing educational programs to help nurses recognize signs and symptoms of violence in the work setting, as well as actions that will prevent and stop any abuse, along with having a structured system of reinsurance in place to encourage staff to report bullying and harassment episodes. Sarah and I want to thank you for taking the time to watch and listen to our presentation. Bullying and harassment is still very prevalent in the workplace, yet is a sensitive subject to talk about. The organization as well as leadership and management, must take on a more proactive role instead of a reactive role when it comes to bullying and harassment. What is in place now as far as laws, position statements, policies, and procedures is a good start, but there's always room for improvement. With continued self-examination, promotion, education, and support to the staff by the organization, hopefully bullying and harassment in the workplace can eventually be eliminated. In the meantime, however, if you are experiencing bullying and harassment in the workplace, please seek out your immediate supervisor and report it. Thank you.